Welcome. Let's talk about the sonographic examination of hip. The sonographic examination of the hip is conducted in 4 different quadrants: anterior, posterior, medial, and lateral. The systematic technique of the hip examination is for learning and teaching purpose only. The examination of the hip is usually focused to the structures based on the clinical impression. In this presentation, I will not go over the details of 4-quadrant examination. I will only talk about the structures which are most commonly examined. The anterior hip is very easily accessible to the sonographic examination. The patient is placed supine with the hip joint in mild external rotation. Based on the depth of the hip joint tissues, a lower frequency curvilinear transducer may be required for the sonographic examination of the anterior hip. The longitudinal and transverse scans are performed over the femoral neck for evaluation of the femoral head, neck, and for evaluation of the joint of fusion. Scans are performed in the sagittal and axial plane for the evaluation of iliopsoas tendon and bursa. Now, here is your scan over the longitudinal axis of the femoral neck, and here is the scan on the transverse axis of the femoral neck for examination of the femoral head, neck, and the joint recess for examination for synovial fluid. Now, the transducer is oriented along the axis of the iliopsoas tendon for the sagittal axis of the scan to look for the iliopsoas bursa and for the examination of the iliopsoas tendon, and the axial scan is placed at 90 degrees to the sagittal scan. Let's look at a sonographic image of the anterior hip. Here is your sonographic image based on the longitudinal scan of the anterior hip. What you're looking at here is the position of your transducer on the femoral neck, and here is your transducer again with the muscles intact. What you're looking at acetabulum, the labrum, femoral head, femoral neck, and here's a little osteophyte you're looking at. You're looking at the joint capsule, and based on this image, if you're looking at, you'll be looking at in the proximal part, you look at the iliopsoas muscle and the muscle and tendon. Then you're looking at erectus femoris. And in the superficial view, you're looking at an oblique view of sartorius. Look at this image. This is exactly what it's showing. Here is your iliopsoas, here is your sartorius, and here is your erectus femoris. If you compare this picture with this image, clearly from superficial, you have an oblique view of sartorius, and then in the proximal part, deeper to sartorius, you're looking at the iliopsoas, and then in the distal area, again deep to the sartorius, you're looking at the erectus femoris. Then you start looking at your bony landmarks and the joint capsule. Here's a view of your structures seen on the sonographic image on the short axis scan of the hip. Now, what are you looking at? Here is your transducer. If you're looking at the structures, the pectineus is sitting here as the most medial structure, sitting on the pectoral pubis, and here is the bony structure, here is your pectineus, and then next to that, superficial to iliopsoas, you're looking at the neurovascular bundle, and then lateral to that, you're looking at your rectus femoris. So if you clearly look into this view, and you could easily recognize all those structures and in this sonographic image. The sonographic examination of the lateral hip is conducted with the patient lying on the opposite hip in a lateral position. Longitudinal and transverse images are obtained from proximal to the greater trochanter to identify tensor fasciae lata, gluteus medius, and gluteus minimus muscles. Once the muscles are identified and evaluated, then the probe could be shifted into the longitudinal axis of the muscles for identification of the attachment of those muscles and the evaluation of the bursa. Here is your scan. You're seeing that this transducer is being moved from proximal to distal, and here is your short axis view. What you're looking at here, you're looking at the skin, subcutaneous tissue, and here the whole region. What you're looking at is the ITB, tensor fasciae lata, and here is your gluteus maximus inserting into ITB. Now deep to ITB, what you're looking on the lateral aspect is the gluteus medius. Here this person seems to have a subgluteus medius bursa, and on the anterior aspect, on the anterior facet of the greater trochanter, here is the attachment of your gluteus minimus muscle. On the longitudinal scan, and the transducer is shifted, here is your gluteus medius and here is your subgluteus medius bursa, because I put my finger up here when I was scanning this, and then shifted my transducer at 90 degrees to take this image. As discussed earlier, the anatomical structures on the examination of the posterior hip are piriformis, sciatic nerve, obturator internus with superior and inferior gemelli, and the quadratus femoris. Here is your piriformis. Ideally, for the examination of the piriformis and the posterior hip, the patient should be lying prone with the feet hanging out of the examination table. But most of my patients have a hard time getting into a prone position. So I usually examine the patient in a semi-prone position with the examination side up. You should examine the piriformis muscle as it emerges from the anterior aspect of the sacrum in the greater sciatic foramen. Here you see the sacrum. Here is the piriformis emerging from the anterior aspect of the sacrum into the greater sciatic foramen to its attachment to the greater trochanter. If you look at the scan, you're looking at, here is the edge of the sacrum. Here is your piriformis emerging out of the greater sciatic foramen, going to its attachment to the greater trochanter. And deep to that piriformis, you should be able to see the sciatic nerve as it emerges from the pelvis in the greater sciatic foramen. The way I conduct a scan for the piriformis is, what I do is I start scanning at a line joining the posterior superior iliac spine and anterior superior iliac spine, and start scanning towards the ischial tuberosity. So the moment I enter into the greater sciatic foramen, I'm seeing the piriformis sitting deep into the greater sciatic foramen, merging from the anterior aspect of the sacrum into the greater sciatic foramen. And if you look into this video clip, what you're looking at, you're trying to scan, you don't see the two bones separate. The moment you're getting into the greater sciatic foramen, you will see that little notch of the greater sciatic foramen, and then deep to that you will be seeing your piriformis sitting into that greater sciatic foramen and your sciatic nerve deep to that piriformis muscle. You're seeing here is your piriformis, here is your sciatic nerve. Let's look at another important structure on the posterior hip, which is the sciatic nerve. Now, if you look at the sciatic nerve, you could actually scan and look at the sciatic nerve as it is crossing between the ischial tuberosity and the greater trochanter. Here is your ischial tuberosity and here is your greater trochanter. The moment you place your transducer on one end on the ischial tuberosity and other on the greater trochanter, what are you looking at? You're looking at the sciatic nerve crossing superficial to the quadratus femoris. Here is your ischial tuberosity and here is your quadratus femoris going towards the attachment to the greater trochanter at the quadrilateral, and here is your sciatic nerve sitting superficial to the quadratus femoris.